My name is Rich Newell. I'm the president and CEO of Temple Health Chestnut Hill Hospital. Becoming a hospital administrator was not my plan in life. Got into pharmaceuticals thinking that I could make a difference and have an impact and improve people's quality of life. And that's true to some degree. That's true, but it wasn't the direct patient interaction that I had looked for. So I met my current wife, that we met in PT school. She was from Philly. I was from South Florida, and we're still in Philly. So you see who won that battle. Worked at Temple Hospital for, I guess, the first 6 years of my career. A smaller hospital, but it was a better salary, and I had our first child on the way. So a little bit extra money wouldn't hurt in that situation. I had moved up the ranks from physical therapist to manager of physical therapy to director of physical therapy to director of operations to chief operating officer, and then transitioned to Central Pennsylvania, where I got another chief operating officer position at Carlisle Hospital. Was there for about 6-7 years, and had the opportunity to transfer to within the company to Pottstown Hospital, which brought us closer to home. And I was there for almost 10 years and ran Phoenixville and Pottstown hospitals for the last 3 years of those. And then I've been here at Chestnut Hill going on 1.5 years. Approached by the Temple leadership, it was a turnaround situation. It was this hospital was close to closing. I had had some success in my previous 3 hospitals of doing a turnaround. That's why they were interested in me coming on board. And when I talked to, again, the Temple leadership about their vision and direction for this hospital, it was very exciting and kind of called to me. And it's going to sound corny, but my wife was born at this hospital. Her brother was born at this hospital. Several of her uncles were born at this hospital. So to have the opportunity to help move it forward and away from the challenges that it had with the potential closing, that was very exciting. I think it has to come down to our quality scores. When I came on board here, we had some struggles with areas that are very important to the outcomes of the care of the patient. One is catheter-associated urinary tract infections. The other one is central line bloodstream infections, and those are kind of the measuring stick for hospitals. And we were at a spot that we were significantly worse than the national average. We've seen, as we've taken that score of a D, and in 1.5 years, the changes that we've made and the things that we've instituted in terms of patient safety, we're now beating that leapfrog benchmark for our score and our percentile ranking. So it'll take us probably to a mid B, low A, and that usually takes much longer to do, but the team really did embrace the focus on quality. And not to say my predecessors didn't, because that's not a fair statement. They did not have that I do have, is the support of a health system that's invested in this hospital. And I think that's what I'm most proud of, is that when I recommend this hospital to anyone in the community, that I know they're going to get outstanding care. I know they're going to get great outcomes. And I'm not guessing, I know it, because the documentation and all the data shows it. Working together with some of the groups, the Chestnut Hill Community Association, we work closely with the folks down at the museum, with Whitmere and the college, and there's so much going on here that makes this a desirable community visit, to live in, to support. The Pastorius Park concert series, supper sessions in Mount Airy. The whole community around us really does rally together. Been married, this will be 25 years this August. I've got three wonderful children. One's in her senior year of college in Chicago at Loyola University. My middle son has finished up his freshman year in North Carolina. He's going to be transferring to Bloomsburg. And then my youngest is 10 years old, going into the 5th grade. They're my pride and joy. They keep me busy and they keep me active. But before they were around, I had a much different lifestyle. I was a competitive skydiver. I jumped for the Pepsi skydiving team in North Carolina for a number of years, and used to do air shows with the Thunderbirds and the Blue Angels and all of that. And so I was a flying Elvis for a while, and doing different demonstration jumps. And like I said, there was a competitive world that I used to live in, that I in some ways miss, in some ways don't. There's such similarities between the mission we have at the hospital and the mission of Rotary, and it really comes down to improving people's quality of life, recognizing that things just don't happen. If you want something to change, you have to be the agent of that change. And I think people get into healthcare the same reason people get into Rotary. They want to make a difference that matters, and a difference that is something more than them individually, something that has an impact on many people. I first was initiated or introduced to Rotary back, almost 15 years ago. Just really impressed with the work that they were doing, and so got involved there. And that theme we mentioned at the end of and make it fun. It's hard work, but Rotary somehow does make it fun, and the people make it fun. And I've already been able to see that at our local Chestnut Hill Rotary. So it just comes down to service and having an impact, making a difference. With the growth in the Chestnut Hill Rotary over the time that I've been here, and just sitting in the meetings and listening to the number of new members, because that is unique. Trying to find volunteers for anything, whether it be children's sports or different things at the hospital, everyone's so busy that to actually find people willing to give of their time and volunteer for a bigger cause, that's not the norm anymore. And to see the growth that's happening at the Chestnut Hill Rotary, that's exciting. And again, it's something else that draws me to the organization.